Hi, today in the biopharmaceutics and pharmacokinetics. Let's have a introduction of pharmacokinetics and its basic concepts. What is meant by pharmacokinetics? In the pharmacokinetics, it is a rate process. Rate, which means it deals with the kinetics, means movement of drug and its metabolites. How it will move means by a process of absorption, distribution, metabolism and excretion. These are the basic process. So totally we can explain the pharmacokinetics as a kinetics or movement of drug and its metabolites by a process called as absorption, distribution, metabolism and excretion. Then when we apply this pharmacokinetics to a patient, an individual patient, then it is called clinical pharmacokinetics. When it is applicable to individual patients. What we have to apply means pharmacokinetics. Pharmacokinetic principles when applied to the individual patients, then it is called clinical pharmacokinetics. Then what is meant by absorption? Simply we can say absorption. Transfer of drug from site of administration to the site of systemic circulation. Systemic circulation. Simply it can be called as absorption from the site of administration to site of systemic circulation. Next, what is distribution? This is the net transfer process from the systemic circulation to the various tissues. So systemic circulation to tissues, site of administration to systemic circulation. Then metabolism. Metabolism means chemical conversion. Simply we can say chemical conversion or bioconversion of drug to its metabolite. For this we can go for phase 1 and phase 2 reactions. Then finally, what is excretion? In the excretion, it clearly says that removal of drug from body. Either in the means of sweat, urine, etc. Removal of drug from body. So these two or maybe collectively called as elimination. Metabolism and excretion can be collectively called as elimination. So then come to the concept of what is happening to drug. We can estimate this drug by simply drawing the plasma concentration time curve. This is the curve where in the x-axis we can take as time and y-axis concentration. Then we can explain it by simple terminologies. Minimum effective concentration. Minimum effective concentration. This is the minimum concentration of drug required to produce therapeutical action. Therapeutical action. Minimum concentration of drug. So here we can divide it into different zones. Here we can say that minimum effective concentration. When it crosses the minimum concentration, then only it can elicit the pharmacological action. This is maximum therapeutic concentration, MTC, maximum therapeutic concentration. This is also called as maximum safe level. Maximum safe level. So, when the drug concentration exceeds this one, then it causes side effects or untoward effects. Beyond MTC, we can get the side effects. This is the maximum safe concentration, but beyond this we can get the side effects or therapeutical untoward results. Next, therapeutic range or therapeutic window. Range or window. The range between minimum effective concentration to maximum therapeutic concentration. This is called as therapeutic range or therapeutic window. Next, onset of action. Onset of action. Time period required to achieve minimum effective concentration. Time period required to achieve minimum effective concentration. So time period to get this minimum concentration, this is called as onset of action. Onset of action. Then termination of action. Termination of action. Time period after which the drug level fall below the minimum effective concentration. The time period at which the drug concentration falls below MEC, minimum effective concentration. So this is onset of action. This is termination of action. Termination of action. Then duration of action. Duration of action. It is defined as length of time for which blood level remains above the maximum therapeutic level and below the minimum safe level. So above the minimum effective concentration and below the, so the time length which blood level remains, level of drug remains above MEC and below MTC, then it is called duration of action. Next, Cmax. Cmax. So simply you can say maximum safe concentration of drug. So here we can see it as maximum safe concentration of drug. This is represented as Cmax. Next, Tmax. The time at which we can obtain the Cmax is called as Tmax. Area under curve, AUC, is defined as total integrated area under plasma level time curve. Total integrated area under plasma level time curve. So area under plasma level time curve, AUC. So this is all called as AUC. So idantha kuda AUC. Then fraction of dose absorbed. This is not commonly used, but we have to know about it. So ratio of amount of drug reaching the systemic circulation. Ratio of amount of drug reaching systemic circulation. So mathematical models will explain the data related to this pharmacokinetics. So in order to study the pharmacokinetics, we are using the physiological fluids. Physiological fluids are having the significance such as blood, urine, saliva, milk, etc. So these are the physiological fluids, and the first place goes to blood, and then urine, saliva and milk. In the rare cases we can go for that. So pharmacokinetics can be studied in these biological fluids. So this can be expressed by the mathematical models. We are having several models, mathematical models. So in that we have frequently using compartment models, physiological models, physiological pharmacokinetic model, then non-compartment, and then non-linear pharmacokinetics. So these are the mathematical models which will express the pharmacokinetics. When we are going to study these, first we have to know the human body. So human body is having the highly perfused tissues and poor perfused tissues. So highly perfused tissues will come under central compartment, the pharmacokinetics. So in the compartment models, we are having mammillary and quaternary model. And these are all special cases. Mammillary model is having this central compartment along with the peripheral compartment. Central compartment when distributed in between peripheral compartment, then it is called mammillary model. So every peripheral compartment is having in connection with the central compartment, then it is called mammillary model. Apart from this, the central compartment is connected to the peripheral compartment like a train bogies. Then this type is called as quaternary model. So this is called here mammillary model. peripheral compartments P1, P2, P3 all are connected to the central compartment, then it is called mammillary model. When they are sequentially arranged, then it is called as quaternary model. So this is the brief introduction of pharmacokinetics, basic pharmacokinetics. Further, with this we can get the basic concepts. Thank you.